Hi everyone, and welcome back to the Healthy Life Blueprint. In today's video, we're diving into a topic that's not often talked about, but is incredibly important for your health: diarrhea. We'll cover what it is, the common causes, the signs and symptoms to watch out for, how doctors diagnose it, and the best ways to treat and even prevent it. Whether you're looking to understand mild tummy troubles or want to learn how to handle more serious situations, this video has you covered. So stick around to the end because you won't want to miss our tips for prevention and staying healthy. What is diarrhea? Diarrhea is the passage of loose or watery stools 3 or more times a day. It's important to understand that diarrhea isn't a disease itself, but rather a symptom of an underlying issue, such as an infection, food intolerance, or chronic condition. While it can sometimes be mild and resolve on its own, diarrhea can also indicate a more serious health problem. There are 2 main types of diarrhea: acute and chronic. Acute diarrhea typically lasts a few days and is often caused by infections or dietary factors, such as eating contaminated food. Chronic diarrhea, on the other hand, persists for more than 4 weeks and is usually linked to underlying medical conditions like irritable bowel syndrome, IBS, or inflammatory bowel diseases like Crohn's disease. Globally, diarrhea is a significant health concern, especially in developing countries. It's one of the leading causes of dehydration and malnutrition in children under 5, contributing to millions of preventable deaths each year. Proper hydration and medical attention can be life-saving in these situations. Causes of diarrhea. Diarrhea can occur due to various reasons, and understanding the cause is key to effective treatment. Let's break it down into a few categories. Infections. Bacterial infections, such as Salmonella or E. coli, often result from consuming contaminated food or water. Viral infections like rotavirus are common in children and can spread quickly. Parasites like Giardia can be contracted through untreated water sources. Dietary factors. Food intolerances, such as lactose intolerance, can cause diarrhea after consuming dairy products. Spicy, greasy, or oily foods may irritate the digestive system, triggering diarrhea. Medications. Antibiotics can disrupt the balance of good bacteria in your gut, leading to diarrhea. Overuse of laxatives can also have a similar effect. Underlying conditions. Chronic conditions like IBS, Crohn's disease, or celiac disease often involve recurring diarrhea as a primary symptom. Other causes. Stress or anxiety can sometimes upset the stomach and lead to diarrhea. Travel-related diarrhea, also known as traveler's diarrhea, often results from consuming unfamiliar or contaminated food and water. Before we get to the next point, I just want to take a second to say thank you for watching. If you're enjoying this, please hit that like button. And if you want more content like this, make sure to subscribe and click the bell so you'll always be in the loop. If you're already subscribed, drop a hey in the comments so I know you're here. Now let's keep the conversation going. Signs and symptoms. The common symptoms of diarrhea include frequent loose stools, abdominal pain or cramping, and an urgent need to defecate. While these symptoms are often manageable, it's important to watch for signs of more severe conditions. Dehydration is a major concern and can present as dry mouth, excessive thirst, dizziness, or dark-colored urine. Other serious symptoms include blood or mucus in the stool, a high fever, or significant weight loss. If you experience any of these, it's crucial to seek medical attention immediately. Diagnosis. When diagnosing diarrhea, healthcare professionals start with your medical history and a physical exam. They may ask about recent travel, diet, or medications to identify possible causes. Stool tests can help detect infections, parasites, or blood, providing valuable clues. Blood tests may be used to check for underlying issues like inflammation or nutrient deficiencies. In chronic or severe cases, imaging or an endoscopy might be necessary to examine the digestive tract more closely. Treatment options. For most cases of diarrhea, home care is the first step. Staying hydrated is essential, and oral rehydration solutions, ORS, can help replenish lost fluids and electrolytes. A gentle diet, like the brat diet, bananas, rice, applesauce, and toast, can also be soothing for the stomach. Medications, such as antidiarrheal drugs like loperamide, can be used for short-term relief. If a bacterial infection is the cause, antibiotics may be prescribed, but they're not effective against viral or parasitic infections. Addressing underlying conditions is key for chronic diarrhea. For instance, treating IBS or managing celiac disease through a gluten-free diet can provide long-term relief. Prevention is always better than cure. Practicing good hygiene, such as washing your hands frequently, preparing food safely, and drinking clean water, can reduce the risk of diarrhea. In some cases, vaccinations, like those for rotavirus, can be life-saving. Diarrhea is a common condition that can range from a mild inconvenience to a serious health concern, but understanding its causes, symptoms, and treatment options is the first step toward effective management and prevention. Remember to stay hydrated, watch for warning signs, and seek medical advice when necessary. With that said, thanks for watching. If you found this video helpful, hit that like button, subscribe to our channel for more health tips, and share your thoughts or questions in the comments below. And until next time, stay informed and stay healthy.